Good morning and for you, and good evening in my country, in Argentina and in Latin America. Thank you so much for the opportunity to participate in this meeting. It's a great honor for me to participate in this meeting with experts as you are, because I know why, in my case, you consider an expert, but because I don't know an expert, but. As part of patient association, I need to share with all of you our experience in the follow-up of LHON patients treated by gene therapy 5 years ago in China, in Wuhan, for the Professor Li team. The idea is interchange the information about the results of our patients 5 years after, and our experience as patient association to support these patients in different kinds of situation they need to transfer. Well. The first table implies 2 cohorts which was treated during 2018. All of the patients are in the chronic stage of LHON, and the time of the debut, from the debut of LHON, was from 1 year to 12 years. This is a special thing because the results of the patients are similar in patients with few time from the debut, and the patients with a long time for the debut. In our patients, the first cohort were 7 boys from 15 to 22 years old, between 11 months to 3 years, and 90 months from the debut. They received the gene therapy in May 2018, and the second cohort included 3 patients, 2 with long-term, 11 and 12 years from the debut, and our younger patient with 9 years old, who had more than 1 year from the debut at the time of the gene therapy. All patients had different levels of vision with the best correction between only light perception, in some cases, vision bulk, hand movement at short distance, count fingers at short distance, and only one of the patients has had in this moment 5/10 of vision in the best side. Well, the photographs show the 2 groups of patients at the airport. The interest of this photograph is for example, in this group, this patient has the white cane because really he has only light perception in this moment. In this moment, here the group, it was in China with Professor Li and Juan, and this is the second group. With Valentin, who was the younger patient, and the other patient with 11 and 12 years old from the debut. Obviously, it's important to take into account that the follow-up was programmed according to the indication of the clinical trial, and Dr. Alejandra Tacle was the neuro-ophthalmologist in Argentina. I am a biologist, I am not an ophthalmologist. then Dr. Ciccoli was the neuro-ophthalmologist who realized all the controls of the patients before gene therapy and after gene therapy during all the year into the clinical trial and after controls. For example, last week with the control of 9 of the 10 patients it was included in this presentation. The visual acuity of the patient was significantly better than the original measure before gene therapy in all patients, including the patient who had the worst performance, but he began from minimal light perception. The vast majority of the patients had better near visual acuity from the initial measure at 1 year from gene therapy and maintaining the measure at 5 years from gene therapy, and some of them improved even more than in the 1 year's control. Well, this slide shows the evolution of, I will talk about determinate patients with different characteristics. This slide shows the evolution of visual acuity, visual field, and functional vision of 2 patients. The patient 2, this is Bruno. Bruno has the white cane at the airport in Buenos Aires, and now Bruno is driving his bicycle, doing his mathematical homework, and he is now studying at the university physics. He has low vision at this moment, but the eye injected was the right eye. This is the last visual field of Bruno. She's playing doorbell. His condition is better than the visual vision before gene therapy. This other patient with the classical patient with 3 years from the debut, with a visual acuity so low, and at the last week the control said 20/40 and 20/100. Then his visual acuity is better than the visual acuity taken 1 year after the gene therapy. 5 years after, she is a little better than the control of 1 year after gene therapy. He is driving his bicycle at the night in this moment, and the visual field is so different than the visual field at the initial before gene therapy. In the other patient we taking into account is the patient number 3 in our cohort, our first cohort. He began debuting with LHON in 2015. The texts about this patient are so clearly to take into account the difficulties that the textbooks he had during all the period of the LHON evolution. He was so angry with the disease. After he had a little better possibility, after he received the gene therapy after 2 years and 7 months from the debut. And after gene therapy, the change is obvious and so important. I don't know if this is the eye injected. This is the situation of the visual field last week. At this moment, this patient could play ping pong indoor and could play and can play tennis outdoor. Then the far vision is a little good than at the first time. The visual, the near vision. It's so interesting. He returned to the university. He's in third year of kinesiology, and the near visual acuity is in 20/20 in one eye and 20/40 in the other eye. Wait a minute. This patient is the first patient. He had the better visual acuity at the moment of the gene therapy. She now has 20/20 near and 20/20 far in far vision, but he has a visual field with a ver si pasa, o sea, they say to me if the slides are passing, because I don't know. I am passing the slides, but I think I talk about one patient and you see another patient. Excuse me. In this case, this patient was the patient who had the better the better condition at the time of the gene therapy. At this moment, last week, he had 20/20 at the near vision and 20/20 at the far vision. The visual field is not the best visual field. He referred differences or some improve in color vision, but not total improve in color vision. He has a great visual acuity, but he has not a perfect visual field. The patient 8 is the second cohort, is the patient with 12 years from the debut of LHON. You can see the visual fields at the moment before the gene therapy, and this is the visual field 15 days ago. Is so different, the visual field. This patient changed absolutely her life, because he was tracking books in her work, because he can't read absolutely nothing, and he can read. He has a visual acuity 20/33 at this moment and 20/80. He has low vision, but relative good vision. And his autonomy is absolutely different than first to the gene therapy. It's important the date in the case of this patient, because he had 12 years from the debut of LHON-ND4. Well, and this case is the younger patient, the patient who was treated at 9 years old. The visual field at 9 years old, previous or before gene therapy, was this visual field, and those visual field are the visual field of the last week. The change is his letter at the school text is obvious. The difference. He has 14 years old at this moment, and obviously he advanced. He improved his vision during all the time. At the first year, he could see the text, the school text, without any aids. And at this moment, he has 20/20 at the visual, at the near vision. And he's playing football and he's playing another sport. When he debuted with LHON, he lost all the sport possibility, because really he always sat with adults because to talk, because really he don't have autonomy to move in places he don't know adequately. Well, as in all our cases, the injection was in only one eye. And we cannot explain, obviously, with our data, why the second eye has almost the same improvement as the injected eye. And as observation, to take into account only as observation, because it's only what we can say about this, in the 3 or 4 patients, the not injected eyes improved before the injected eyes. We understood in this moment that the injection could produce any inflammation and or arthritis, and then this was the explanation in this moment, but we cannot explain exactly why this improvement was before of the to the not injected eyes versus the injected eyes. But obviously, only in one case we maintain the difference between the two eyes, because in all the rest of the patients, the advance in the two eyes was similar, but the injection was in one eye, only in one eye. Well, the mechanism we cannot explain about this. As a patient association, we are interested in the impact of dramatic changes in the vision of patients with LHON, which is different from the gradual loss of the vision in other retinal or optical nerve dystrophies, which is absolutely gradual. In this case, in LHON, is dramatic, is the one day for the other. Then all the patients were referred for depression and anxiety. Is so important to take into account, because it's the center of the treatment of the patient. Out of the gene therapy, one other treatment we can prove. The health intervention as patient association, especially directed to the psychological and psychiatric contention, and obviously as the right, because for this patient is so difficult at the age of the initial LHON to continue with the school or with the university or with the recent job. We have a lot of elements at this moment to contain the patients, because, for example, there are a resolution on Assembly of United of the UN, because the special attention for the rare diseases. This resolution of the November 8 is so important for researcher and for patient association to take into account this resolution, because it's a key to access to the better research and the better access to the therapies. It's so important to take into account the difference of the LHON progression and to the other retinal dystrophy, because it's so different the prognosis. Then for us it's so important to take into account this particular issue. Thank you so much, and excuse me for the difficulty with the slides.